Hi, I'm Amar Jory, and welcome again to the CINQ Lab. In this second segment of our microlearning series, we are building upon our previous video in which we presented the CCS-CHRS position statement on the cardiovascular screening of the athlete. Here we are now presenting implementation of these recommendations in the form of a screening program conducted at Queen's University. This presentation was put together by Nick Grubik, who will also help us present a case later in this video. This program was first implemented in 2017 and encompasses 2 years of data from varsity athletes. Let's take this opportunity to review the tiered program presented in the position statement. As you may recall, the CCS Sport Group recommends that a screening program begin with a foundation of high-quality emergency protocols. We then move up to an enhanced program involving a network of disciplines. We also discuss implementing an expert-led shared decision-making program. We implemented these tiers at Queen's University and then went beyond by adding a screening history, physical examination, and ECG. This diagram shows the program in more detail. As mentioned, we asked all incoming athletes to have a general medical and family history questionnaire completed. As part of this package, we had forms asking for the athlete's primary care physician to complete a physical examination. We included an important workflow innovation in our screening program with respect to this package, in that we got the ECG to be completed by the primary care physician and have all of this material sent in with the athlete's package. Back at the institution, we were organized and ready to receive this material. Our team included an administrative assistant, an athletic therapist, a sports physician, and myself as the cardiologist. During our 2-year program, in total we received 517 packages from incoming athletes. Our administrative assistant did the first check and confirmed that 438 packages were fully completed. Of these, there were 114 red flags, which were for any cardiovascular or non-cardiovascular concern. These packages were then reviewed by our athletic therapist and referred for assessment by our sports physicians, who are experienced ER doctors specializing in sports medicine. From this group, they identified 12 athletes requiring further cardiac review and requiring referral for assessment by a cardiologist. As you can see, we took a stepwise approach to clearance of our athletes. The following slide has a video of an example from the athlete's clinic of an athlete that was picked up during the screening process and eventually referred for cardiology assessment at our screening center. So I'm the cardiologist here in the clinic.
Okay.
And you've been referred to me by the emergency room physician, the sports physician on the team. So as you may know, we're screening all the incoming athletes and as well as some of the returning athletes. And so what we're looking for are any abnormalities or red flags that might worry us about your participation on the field. So I'm going to just ask you a few questions, and I'll explain to you what was picked up during the screening, and then give you an opportunity to ask any questions. We'll take a listen to your heart, do a quick look of your heart with my ultrasound machine that I have here today, and then we'll talk about next steps. Does that make sense?
Yeah, that's perfect.
Okay,
Thanks.
great. So what Dr. Graham had pointed out was your ECG. So this is the electrical signals of your heart. And you have some changes on these signals that could suggest an abnormality, or they could be part of the normal physiologic adaptation a lot of athletes undergo. So we're not too worried about this finding right now, but it's always good to double check and take a look and make sure things are okay for you to participate. Okay? All right, so I'm going to start with your hands here and just take a look. Great. Okay, I'm just going to feel your pulse here. And I'm going to get you to put your chin up and to the left there. Okay, great. When I tap on your shoulder, what I want you to do is bear down, so flex your abdominal muscles, but try not to change your breathing. Put your left arm up, okay? And I'm going to put my stethoscope here, and now I just want you to watch the machine here and rotate towards the left there, okay? Yeah, just turn your body towards the left. Exactly, yeah. So that concludes the cardiac part of the cardiophysical exam. I'm just going to take a few scans of your heart. This is not a full echocardiogram, this is just a scan of your heart, and we may still have to send you for the full test a little later on, okay? But we'll take a look here. Getting some really good pictures. So the gel is kind of cold, I'm sorry about that. I'm just going to show you here. So what we have is a picture of your heart here. This is your left ventricle, so that's the main pump of your heart. And in this view, I can also see the right side of your heart, and I'm looking to see if the right side is enlarged or if there's any abnormality there, and it's looking pretty normal. The other thing I can do is put on some color, and this just helps me look at the flow of your heart. And I'm just checking to see if there's any leakiness across any of your valves, and they look pretty good. So this is all very reassuring. So I'm looking at that main pump of your heart again, except now I'm looking at it from a different angle to sort of slice it like a loaf of bread. And I can see that it's pumping away very nicely. So again, what I'm looking for is any thickening, any abnormal thickening of your heart, any problems with the motion of your heart, and you can see that it's contracting quite nicely, thickening quite nicely. Welcome back to clinic, Nick. So I saw you, looks like last week. How have things been since last week?
Yeah, everything's been normal.
Okay, great. You've been competing and stuff?
Yeah, so it was just the training.
Okay. Well, your tests came back. We had the formal ultrasound done, the echocardiogram, that supplemented what I did in the clinic, and it looked all normal, so that's reassuring. So basically, we're very happy with the results that we have right now, and just want to reassure you that it looks like you're good to go. So we're going to clear you to continue with participation, and that'll show in the system, and your coaches and your therapist will be all aware. So perfect. I didn't pick up any abnormalities, what I was worried about.
Okay.
But if you have problems in the future, like if you're still a little bit worried, you can come back and we can chat, we can talk about things, and we can do more tests if they're necessary at the time. Okay?
All right.
So,
that sounds great. Yeah.
All right. Well, nice to meet you.
Thank you very much.
Have a great season.
Thanks.
During the screening process, we found an interesting case that demonstrates the value of our program. I've asked Nick Rubik to tell us about this case next.
Hi everyone, my name is Nick, and this is a case of an athlete we detected in our screening program this past year. An 18-year-old male rowing athlete presented with a Wolff-Parkinson-White pattern on his electrocardiogram, or ECG, which was sent in by the athlete's primary care physician. This ECG syndrome is a condition in which there is an accessory electrical pathway in the heart, which can lead to periods of rapid heart rate. We will be creating a new teaching module to better explain this later in our series. The athlete's cardiovascular screening questionnaire that was sent in with the screening package indicated no previous syncope, angina, or shortness of breath at rest or during physical exercise. In addition, the physical examination was unremarkable, as indicated by the physician. A point-of-care ultrasound procedure performed by Dr. Jory was also normal, indicating no structural abnormalities as a result of this condition. Upon further discussion with the athlete, it was indicated that he experienced 3 previous episodes of strong and rapid palpitations, one of which occurred during exercise. In order to manage this high-risk ECG abnormality, The athlete was consulted with using a shared decision-making process. This approach involved a choice awareness to ensure informed consent for screening was provided, an options dialogue to discuss whether or not the athlete was safe to participate in sport, as well as a decision discussion to discuss sports restriction or participation. This shared decision-making process involved the athlete, coaches, parents, as well as a multidisciplinary sports cardiology team at Queen's University, consisting of athletic therapists, sports physicians, an electrophysiologist, and a cardiologist. To further investigate this ECG abnormality, the athlete was referred for an electrophysiology and ECG study, where a potentially dangerous bidirectional accessory pathway was found. As a result, the athlete then underwent a catheter ablation to destroy this pathway, resulting in destruction of the Wolff-Parkinson-White pathway with no immediate complications. Throughout this cardiovascular intervention, the athlete, as well as his parents and guardians, were continuously contacted and followed up with to ensure comfort and safety throughout this process. Given the small risk of reoccurrence, the athlete was cleared to ease into training and full competition, with regular cardiac follow-up from Dr. Jory. Overall, the Queen's University Cardiovascular Screening and Care of Athletes program highlights how institutions across Canada can employ a stepwise approach to athletic cardiovascular care, beginning with three main pillars. These main pillars can be seen on the left and consist of a foundational pillar, enhanced pillar, and excellence pillar. This program is then continued by further adding in three screening tiers, which include a screening history and questionnaire, physical examination, and ECG, which are underpinned by support from our national primary care partners across Canada. Thank you, and now I am going to transfer back to Dr. Jory to talk about our future plans for this program.
With the overarching goal to develop pre-participation screening practices across Canada, our team has developed three main questions to lead future directions in this important field. These questions include 1. How do we build a Canadian network for the translation of the cardiovascular screening and care of the athletes program across our country? 2. What is the occurrence of cardiovascular disease, outcomes, and risk associated with sudden cardiac death in Canadian sport? And finally, number 3, how do we improve the health and safety and reduce sudden cardiac death and cardiovascular risk for our Canadian athletes? I'm Amar Jory, and I want to thank you again for joining our program. If you have more questions, please visit our website at CINQlab.com, or you can email us at amarschedule@gmail.com. You can also follow me on my Twitter account at Amar Jory.